Welcome to the University of Illinois Chicago Orthopedic Surgery Residency Program. My name is Ben Goldberg. I'm an associate professor of orthopedic surgery at UIC, and I specialize in shoulder and elbow surgery. I want to take a few minutes to introduce you to our program, take you on a virtual tour of the facilities here at UIC, and wrap things up by discussing our current residents and alumni. When choosing a residency, you want to look for a program where you will be well trained. You want to have a rewarding and enjoyable experience. You want to be well prepared for post-residency success. At UIC, we take pride in being able to help you achieve these goals. We are one of the oldest orthopedic training programs in the country, and we match 7 of the best and brightest candidates into residency positions. At the completion of our 5-year program, you will graduate as an outstanding clinical and technical surgeon. We accomplish this by having you rotate through several different hospital sites, all of which offer different patient population experiences, thereby giving you the broadest overall exposure to a full range of patient interactions. We are a high-volume program with the majority of our residents meeting their minimum number of required cases by their PGY4 year. The University of Illinois Hospital, UI Health, is the main campus situated in the medical district of Chicago's near west side. It is a 491-bed academic medical level 2 trauma center. There is an orthopedic inpatient floor with a dedicated nurse practitioner and physician assistants. At this site, we have 11 residents here at a time with exposure to adult reconstruction, sports, shoulder and elbow, hand, pediatrics, spine, foot and ankle, and orthopedic oncology. Calls every 4 to 6 days as home call. You will rotate here every year of residency with increasing autonomy as the years progress. As a resident, you will establish continuity of care and be involved in preoperative planning, the surgical procedure, postoperative management, and clinic follow-ups. Christ Hospital, on the south side of the city, is a level 1 trauma center providing a robust experience in a private hospital setting. It is a 746-bed community hospital where 5 orthopedic residents, PGY 3 and up, rotate at a time. Calls every 4 to 8 days in-house with exposure to trauma, joints, spine, foot and ankle, sports, pediatrics, and hand. It is one of the highest volume and highest acuity centers in the country. Lutheran General Hospital is a 623-bed community hospital and level 1 trauma center. There is a private academic experience where we work closely with the physicians of the largest private orthopedic group in Illinois, the Illinois Bone and Joint Institute, which was founded by an alumni of the University of Illinois program. Here, 7 orthopedic residents rotate at a time. As a PGY2, you'll become capable of taking call every 4 to 6 days in-house, mastering reductions, and learning ED management. As a senior resident, you work with 2 fellowship-trained trauma surgeons and will have the opportunity to be involved with upper extremity, lower extremity, and complex pelvic fracture work. North Shore University is a system with a 156-bed orthopedic-only specialty hospital associated with the Level 1 Trauma Center, where 5 residents rotate on site at a time. This is our newest site and has had excellent feedback from the residents. Rotations are a mentorship model with exposure to trauma, foot and ankle, sports, pediatrics, and hand. Calls every 4 to 7 days with home call. Shriners Hospital for Children is a private 60-bed elective hospital for children with orthopedic conditions. 3 residents rotate here at a time. A PGY2 is on the orthopedic spine service, and 2 PGY4s are on the general pediatric orthopedic service. Call is home call. Every week, you will spend time in the gate lab at the 2nd busiest Shriners Hospital orthopedic service in the country. For the purposes of time, I would like to take the tour to focus on the University of Illinois Hospital, our main site for the residents. The OR at UI Health consists of 20 different operating suites with dedicated orthopedic operating rooms. Our procedures range from primary total joints, common sports and hand cases, to complex revision and oncologic cases. Additionally, they are breaking ground on a brand new surgery center across the street from the hospital. Each hospital site has its own unique educational series. Every Wednesday morning, however, the residents and faculty participate in a residency-wide conference. Traditionally, we've held the conference at the Orthopedic Conference Room at UIC. Because of social distancing, we've gone to a virtual conference. Lastly, I'd like to give you a brief look into the clinic workroom, where the residents and students meet to get sign-out, write notes, and place orders. This tends to be a central hub where you can find residents and medical students at any given time throughout the day when they're not in the operating theater. Being in Chicago, our residents are in the prime location to participate in many courses throughout the city at the nearby AAOS Orthopedic Learning Center and at various industry-sponsored events. Our residents also have the chance to cover athletic events at the high school, Division I college, and professional levels. After graduation, our residents are always poised for success. Whether it is continuing your training in a competitive fellowship program or transitioning straight into a general orthopedic practice, we are confident you will be successful and highly sought after. We have had residents go into all subspecialties of the orthopedic field. At the end of the day, our goal at UIC is to help you become whatever type of surgeon you want to be. From a career at an academic center to an orthopedic surgeon practicing in a rural community, we offer the opportunity to achieve your goals. If you have any questions or comments, please feel free to reach out anytime. Thank you for the time, and good luck during the match.